This is a phase 3 trial combining the combination of Nivolumab plus NKTR-214, also called Bempegaldesleukin, which is essentially a pegylated version of interleukin 2. High-dose interleukin 2 is an agent that has been around for over 2 decades, has been approved for the treatment of advanced melanoma, though is limited by its toxicity and therefore the inability to administer it to all of our patients. The response rates to high-dose IL-2 traditionally have been approximately 14 to 15%, though some of the responses, particularly with complete responses, have been long-lasting. Nektar NKTR-214 is a modified version of IL-2. What it preferentially does is cause signaling within what's called the intermediate-affinity IL-2 receptor, beta-gamma. And as a result of that, there's an increase in tumor-infiltrating lymphocytes, or CD8-positive lymphocytes, both on T cells as well as on the NK cells, the natural killer cells, within the tumor microenvironment. And that increases signaling through the T cells and therefore potentially increases anti-tumor effect. As we very well know, Nivolumab by itself is a standard of care as an anti-PD-1 agent in the treatment of advanced melanoma, and now also approved for stage 3 or resected melanoma. The response rates to Nivolumab by itself are approximately 40%, and we have not been able to break that bar in trying to prove the addition of a second agent to Nivolumab improving survivorship compared to Nivolumab alone. This is an attempt at trying to do that where a known active agent such as IL-2 is now being combined in a modified version, potentially to decrease toxicity, because this is a slow release version of IL-2. Typically takes somewhere between 26 to 30 hours to lose the pegylated areas through hydrolysis and therefore release the active moiety and cause CD122 bias signaling within the T cells. So the hope is that the combination will improve efficacy and potentially at a less toxic level.